Good afternoon. Thank you for joining us once again for a COVID-19 update. We have a lot to discuss today, so let's get right to it. COVID-19 has ripped through cities around the world and in our country. As we stand here today, over 50,000 people have died in the United States in just a couple months, and hotspots have appeared in high-density cities like New York and low-density cities like New Orleans. COVID-19 is very real, and our city has treated it as such from day one. Doing nothing in the face of COVID-19 is what would produce the true worst-case scenario, but of course there is no city that has done nothing, so we can only imagine what that would look like. But we don't have to imagine the terrible toll COVID-19 has taken on numerous American cities. In New York, they have lost 135 lives for every 100,000 residents. In Detroit, they have lost 82 for every 100,000 residents. In New Orleans, they have lost 79 for every 100,000 residents. In Oklahoma City, seeing these potential scenarios, we acted fast. On March 15th, we had our first case of local spread. We moved aggressively and declared an emergency that day and began the process of closing off high-risk opportunities for local spread. Now, we are sheltering in place through April 30th, and we will do so because it is saving lives. In taking these actions, we waited for no one. We did what we had to do to save lives. Nevertheless, we have suffered 54 deaths in the metro, 4 lives for every 100,000 residents. Every life is a person, not a statistic. We mourn each one, and we send our deepest condolences to the families. We are at the same time heartened that we have not experienced what could have been. Those numbers pale in comparison to other cities near and far. You should be proud, and if this is the trajectory on which we can remain, you will remain proud all the rest of your days. Oklahoma City will be a case study for how you save lives in a pandemic. As we stand here today, we are 6 weeks into this pandemic. We have lived through the rapid changes. We have settled into new routines. We have grown tired of those new routines. We have cried. We have laughed. We have suffered, and many still do. It has been an epic time in our lives that we will always remember. Today, we face a bit of a crossroads. Not because of any changes in the virus, it's still here. It's still capable of great harm. It doesn't know the dates on the calendar. But external factors dictate that we have reached a point as a people where we have to make some decisions. As we make those decisions, 2 conflicting realities stare us right in the face, and there is no realistic way to alter either one. On the one hand, COVID-19 has no vaccine and no proven treatment, and no such thing appears to be coming anytime soon. We are likely to live in its shadow for many months, maybe years. Without a vaccine or a proven treatment, May 1st isn't likely going to feel any different than August 1st or November 1st. No matter how much we try, we're going to have new cases every day, and deaths will continue to occur as well. The fundamentals of this crisis don't really change until there is a vaccine or a proven treatment. This is our life now. On the other hand is another reality. We can't shelter in place for 2 years straight. I recognize this. This city has risen to this moment beautifully, and we have done all the right things these last few weeks. I am moved to tears by the sacrifices the people of this city have made to save lives. But I recognize that doing this just as we have for 1 to 2 years is not a realistic option. So what do we do? First of all, there's no perfect path forward. I'm sure there's lots of Facebook epidemiologists and libertarians who think they know the answer, but they don't. No one does. I've said from the beginning of this odyssey, all we have are bad options. We're just trying to muddle through and pick the least worst. We want to do the best we can, transparently and thoughtfully, to find a new temporary normal, a middle ground that operates within realities but still prioritizes life and minimizes transmissions and deaths. Part of the reason we face this choice now is that there is a deadline looming April 30th. This is an external factor. This has always been an artificial deadline, but it is a deadline nonetheless. Based on an earlier White House recommendation, April 30th is the day current proclamations at the state and local level expire. Also, we face a choice now because the ground is shifting under our feet. Governor Stitt is lifting his statewide restrictions on all non-essential businesses effective May 1st. He already lifted some effective today. This is another external factor, and it is not at all insignificant. At the city level, we were never a part of the non-essential business closure. That was entirely Governor Stitt's decision, but we did separately close certain businesses with a high risk of spreading the virus, like bars, restaurants, and personal care services. So there is overlap with what he is doing and what we have done. His state-level decisions do not preclude our ability to retain restrictions in Oklahoma City. But there are a lot of practical complications to that approach after his new orders fully take effect May 1st. A patchwork of regulations across the metro is largely unworkable for any extended period of time, and the effectiveness of such an approach in limiting spread would be almost non-existent. Not being able to eat in a restaurant on one corner of an intersection, but being able to eat on another corner is not going to save lives. Also, as I have said from the beginning, in a free society, restrictions are largely self-enforcing, and mixed messages make widespread buy-in almost impossible. I do appreciate that the governor kept me and other mayors in the loop as to his actions, and it is important to our unified public health effort that we are communicating. Would I have picked April 24th or May 1st as the date to start a new phase? My gut says no. But let me also say, I recognize, as I said before, there is a date. We won't shelter in place forever. So how do we find that date? We rely on public health officials, science, and data to help guide us as best it can to a date for commencing a new phase in our pandemic response. So let me set aside the external factors for a moment. Not that they don't matter, they certainly do, but let's pretend for a moment they don't. What does public health tell us about when we could or should start a new phase in this journey? At some point, someone has to put some public health criteria on the table. Last week, the White House did just that. The guidance provided by Dr. Fauci and his team since we entered this story on March 15th has been very useful and has served us well in Oklahoma City. On March 16th, they recommended we close bars, restaurants, and gyms. We did so the next day. In late March, they recommended we extend our shelter in place to April 30th, and so we did. Last week, they offered what they call gating criteria that must be fulfilled to move into a new phase. I asked Dr. Patrick McGough, Executive Director of the Oklahoma City County Health Department and Chair of my Public Health Advisory Group, to consider that criteria. His response was that this was good criteria from the White House. The criteria falls into three categories: symptoms, cases, and hospitals. I think this neatly captures the two main priorities we have always been focused on: saving lives and protecting our healthcare system from collapse. In the last 24 hours, we gathered the best local data we had available to compare against the White House gating criteria. This is current data, not future data, obviously. I accept the reality that after being closed for many weeks, businesses need some notice before they can reopen. Business owners from all industries have repeatedly told me that in recent days. This means that by necessity, we will make decisions for a future date that are based on today's data. With all of that as a qualifier to the data and conclusions I'm about to share, here is how the best available data lines up with the White House gating criteria today. So first up, we have the list of the gating criteria. Greg, can they see that? Okay. So you see here we have the symptoms, the cases, and the hospital data. Moving to the symptoms first, in regards to symptoms, a community must have a downward trajectory of influenza-like illnesses, ILI, reported within a 14-day period. We took all of this quite literally. We have chosen a 14-day period and we have focused on ILI in our local area. As you can see from the chart, based on the best available data and based on where it stands today, we appear to meet this criteria. The second symptom criteria, also in regards to symptoms, a community must have downward trajectory of COVID-like syndromic cases reported within a 14-day period. As you can see from the chart, based on the best available data and based on where it stands today, we appear, by the skin of our teeth, to meet this criteria. In regards to cases, a community must have one of two things occurring. It must have a downward trajectory of documented new cases within a 14-day period, or a downward trajectory of positive tests as a percentage of total tests within a 14-day period. The rationale for this option is reasonable. If you are administering more tests than you were before, you are likely to have more positives. But this may not mean your spread is actually increasing. It could merely be because you are administering more tests. So they allowed you to also look at the percentage of people who are testing positive. In our community, we have increased our testing. And though new cases have not spiked by any means, they are not necessarily on a downward trajectory, and we do not meet the first option. However, this chart illustrates the second option. And based on the best available data, based on where it stands today, we appear to meet this criteria. In regards to hospitals, we must be able to treat all patients without crisis care, which I am told we can, and we must have a testing program in place for at-risk healthcare workers, which I am told we do. Therefore, we meet this criteria as well. All of this means that based on the best available data, and as of today, we appear to meet the White House gating criteria. To summarize, and we're off the slides now? Okay. To summarize, it is the advice of our local public health professionals that the White House gating criteria is worthy of merit. As of today, based on the data we have available, it appears that our situation satisfies that gating criteria. Is it a slam dunk? No. But you can see the charts as well as I can. We appear to meet the criteria today based on the best available data we have, and I can certainly say with confidence we are not in any kind of surge. We appear to be in some sort of decline, or perhaps a plateau after a decline. Even saying all of this, is May 1st the date I would have picked given no external factors? Absolutely not. But I cannot deny that there are external factors and that they are not irrelevant. Also, I cannot deny that the data is, if not overwhelming, at least cautiously encouraging, and it appears to satisfy the gating criteria today. As such, it is my intention to let Oklahoma City's shelter-in-place order expire on April 30th. In the next week, I will replace the existing proclamation with one that reflects the elements of a new phase in our pandemic response that will be effective May 1st. I do not expect that this proclamation will deviate from the openings in the governor's statewide orders. Keep in mind, and I know this can be confusing, but we never closed non-essential businesses in Oklahoma City separately from the governor. So you do not need to look to our proclamation for guidance there. Our proclamation was always focused on the places that are a high risk for spread of the virus. Whether those places are, in the question of whether those places are open or closed, I expect our proclamation to align with the governor's effective May 1st. Having said that, there will be many social distancing and sanitation conditions placed on openings so that public health is still a priority. We will consult the White House guidelines, best national practices, and our local public health officials to develop those conditions. It is my understanding that the state is offering such conditions at the state level as suggestions. They will not be suggestions in Oklahoma City. Also, in keeping with White House recommendations, gatherings of 10 or larger will still be prohibited. Let me also be very clear. May 1st is still a week away. If there is a dramatic change in existing trends, we will reevaluate. Also, May 1st is not a light switch. It is a dimmer. If we show signs of becoming a hotspot, I will not hesitate to act aggressively as I did not hesitate before. I know sometimes it can feel like you're alone and you wonder if your leaders prioritize your life. Well, I do. And I live with that obligation every day. As such, I have very mixed emotions about this. You likely do as well. In fact, I think this is the hardest speech I've given in this pandemic. But as I have thought about this, I recognize that I would always have mixed emotions, because until there is a vaccine or a treatment, there simply is no right answer. We could be standing here talking about June 1st or July 1st, and I would feel almost the same. I am never going to stand here with a big smile on my face until the day we have a vaccine or a proven treatment. Until then, every new phase is an uncomfortable balancing act. I didn't feel very good on March 17th either. I didn't sign up to be the mayor who closed all the bars at 5 o'clock on St. Patrick's Day. But even as I recognize that no new phase in our pandemic response is going to feel comfortable, I recognize we have to move out of shelter in place at some point. If we're going to do it, then let's at least resolve to do it safely. Just because we are opening up economic opportunities, which is a very good thing, does not have to inherently mean we are opening up new opportunities for spreading this virus. It can mean that, but it doesn't have to mean that. Remember, not all the tough choices in this pandemic are mine. In fact, I would argue my role in this fight is minor compared to yours. In the days, weeks, and months ahead, you will make 1,000 choices a day that will determine your fate and the fate of this pandemic. Your life is at stake, and so are the lives of those you love. You must social distance. You must wash your hands. You must wear a mask. You should still telework or otherwise stay home if you can. If you are a decision maker for a business, church, or other group of any kind, you still have to make decisions knowing there is a deadly virus making its way through our community. Just because you can do something doesn't mean you will, and I respect those decisions. May 1st may represent a new phase, and we've earned it through hard work. But it is not a day to run into the streets and hug each other. This virus doesn't care that it's May 1st. My proclamation doesn't make the virus go away. May 1st is a day we should resolve to continue the actions necessary to halt the spread of this virus and continue saving lives. We control whether the changes on May 1st will lead to a new peak. In fact, we control all the peaks ahead. You can throw out the models, because if you want a peak 2 weeks from now, we have the dark power to make that happen any day of the week. Let's use our powers for good. I have reason to believe after this experience of the last month that you will. And while we wait for a vaccine or a treatment, we as a city, state, and nation must continue our efforts to create a robust testing, tracing, and quarantining program that can give people the confidence they need to regain some normalcy. This should be the priority of political leaders, business leaders, and public health officials, because it is a false hope to believe that May 1st will bring a full economic return. The virus is keeping people home more than a proclamation is. I commit to you that your local government is going to do everything it can to bring about the infrastructure in this area that we need. And we should also resolve to continue taking care of those who are suffering. Just because the government has unlocked the doors will not mean that the customers will open them. I ask you to support our local, state, and federal governmental efforts to care for those who are most affected. I ask you to donate to philanthropic efforts, shop from local businesses, and support each other on an individual level. I'm still sending Venmos to the person who cuts my hair every time I would have had a haircut. I'm not sure when I will get back in that chair, but until I do, the Venmos are still coming. This will be a long journey, and in the words of Churchill, this is not the end. It is not even the beginning of the end. But it is perhaps the end of the beginning. So as we potentially move into a new phase, what did we accomplish in this beginning? First of all, as I have demonstrated here every week, when I compare our numbers to other cities, you have saved lives. You stopped an outbreak when our healthcare system and when we as individuals were least prepared. You bought us time. A lot of work has happened behind the scenes this last month, especially in the healthcare sector, that will prepare us should we have peaks still ahead of us. And meanwhile, all of us individually have conditioned ourselves for the road ahead. We weren't ready for this new phase on March 15th. We weren't ready for any of this. We are now. I am very optimistic that people will respond wisely in the weeks ahead in the decisions they make for themselves and others. I believe we will all make better decisions than we would have made on March 15th because we have seen a thing or two these last 6 weeks. I believe we as individuals are as ready for this as we're going to be. Mark Twain supposedly said, "History doesn't repeat, but it often rhymes." In 1918, Oklahoma City waited 11 days to close anything after their first case of local spread. Ultimately, more than 7,000 Oklahomans died from Spanish flu, many of them in Oklahoma City. Hospitals were overrun and churches were converted to house the sick. Just over a month later, much wiser, the worst had seemingly passed, and they reopened many of the gathering places they had closed, with conditions in place that lasted many weeks more. Threats of another outbreak loomed for many months. But sometime in 1919, the threat had passed. This too shall pass for us, but it doesn't pass on April 30th. This is a chapter in our journey. I assure you there is another chapter on the other side of this one, and we'll get there together. We're all in this together. As always, I want to thank the frontline workers in the healthcare sector and so many others that have made it possible for us to shelter in place this last month. And now I'd like to bring to the stage a man who hardly needs any introduction at this point, but a man who leads a team that is certainly responsible for saving thousands of lives in our city during this pandemic. Thank you, Dr. Patrick McGough, for your wise counsel as we have made some tough decisions this week. Dr. McGough.
Thank you very much, Mayor Holt. It is truly an honor and a privilege to serve you, Oklahoma County, and Oklahoma City. And you have quickly become one of my favorite people on the planet. And I appreciate greatly your enormous leadership and strong mind and very large heart. As we approach April 30th and our local and statewide orders expire, I want to remind everyone to approach May 1st with cautious optimism because, as the mayor has stated, we continue sheltering in place until April 30th. We appreciate enormously having had the opportunity to provide Mayor Holt with city and countywide data to help him in his decision making. While there are limitations with testing capacity, we certainly are faring much better, to his point, than many like-sized or larger cities across the nation. I applaud Mayor Holt and all of our elected officials in central Oklahoma for making the tough decisions that slowed the spread of the virus in our communities. And I would also like to thank the citizens of Oklahoma City and Oklahoma County for their dedicated effort in the mitigation of COVID-19. Yet the virus is still circulating, and individuals and businesses in our community will continue to have a role to play and actions to protect themselves and those around them even as reopening starts to occur. In this new phase, we will still be mindful of physical distancing measures to continue slowing the spread. In addition, we still advise residents who are 65 and older and residents who are immunocompromised to continue sheltering at home as much as possible. As businesses begin to open, we know it will be critical to have increased access to diagnostic testing across Oklahoma County. I'm very pleased to announce today that Walmart will open a testing site in southwest Oklahoma City beginning Monday, April 27th, and it will be testing individuals who have one or more symptoms of COVID-19. So starting this Sunday, residents can visit doineedacovidtest.com for more information and to schedule an appointment. Additionally, the Oklahoma City County Health Department testing site continues testing approximately, or an average of, 20 plus individuals each day, Monday through Friday. Robust testing, must be in place and continue to grow as we shift from community mitigation, what we've been doing up until now, to case-based interventions when we will work to control spread by focusing testing and resources on individuals with disease who may be infectious and their close contacts. Sheltering in place gave our healthcare system the time it needed to adequately treat severe cases without being overburdened, and helped reduce the spread of COVID-19 in our community. As we slowly begin the process of reopening, protecting our healthcare system and limiting the spread of the virus remain critical. Public health guidance will be released soon so everyone can adequately plan how best to approach reopening while remaining vigilant and safe. A few recommendations you can expect to see include the following. We will strongly recommend any business that is planning to reopen make mask wearing mandatory for all employees and all customers. We will strongly recommend all individuals continue practicing social distancing in their workplaces and other public spaces as well. We will strongly recommend all businesses consider continued telework wherever applicable. And finally, we will strongly recommend no one gather in groups larger than 10, whether inside a business, church, or other activity. Again, we can be optimistic, but we must be cautious. With your help, we've definitely had early successes, but we have not won the fight. We will continue providing weekly updates to you as we enter this new phase, and know that public health stands ready to closely monitor our situation in Oklahoma County to alert our elected officials in the event we start to see spikes in cases and/or hospitalizations. Finally, we greatly applaud Mayor Holt for keeping public health a part of the discourse throughout a very challenging time when he faces so many extremely difficult decisions. And we realize we are but one sector of the individuals, the industry, the population that he leads. Incredible leaders listen. Mayor Holt has made public health a part of the conversation from beginning to present, and for that, I am more than thankful. At the end of the day, we may not always be on the same page, we may not always agree, but at least we truly listened to each other, and will continue to do so as our COVID response unfolds. And at this time, we will now open up for questions. Thank you.
Starting his date at May 1st. I heard you say, without external factors, you absolutely not would have chosen May 1st. Did you feel like the governor forced your hand? And what would you say to people who think you should keep things closed past that May 1st date, regardless of the governor's action? Thank you.
Thank you. I kind of feel like my speech was spot on and took that question head on, so I'd probably just let it stand as it was. I think I addressed, what role the external factors have in this decision, and also the practical realities of trying to have a hodgepodge of regulations. I mean, there's really no public health benefit to that. It might make us, feel good, from a rah-rah perspective, but if half of the city is not under any kind of regulation similar to Oklahoma City for any extended period of time. I mean, granted, when we began this, we moved fast and we moved unilaterally, but everybody followed us, quickly amongst the other cities, and eventually the state followed as well. That's not the situation here. We would be, hung out to dry for an extended period of time with no expectation that anybody would ever recalibrate their regulations to match ours, and so there would be really no public health benefit to half the geographic area of the metro area trying to behave differently than the other half. So I think, you made me do it anyways, but I did answer a little bit more in depth, but still I would point probably primarily to some of the comments I made in my remarks earlier. Thank you.
Okay, News 9. Thank you, Mayor Holt. The list of strong recommendations from Dr. McGough, why not make those strong recommendations requirements after May 1st?
Oh, we are. And I looked at the camera and tried to pound that home. I'm sorry if you missed that. No. At the state level, and this could change, and this is merely what I've been told, I'm told that their conditions on these openings are suggestions, and I want to be clear, they will not be suggestions in Oklahoma City. They will be requirements.
Dr. McGough had the strong recommendation of businesses, for instance, requiring their employees to wear masks.
That is correct. That is correct.
So let me qualify. We have not talked about what will turn into the conditions. So maybe now I better understand what you're saying. We haven't talked about what will turn into the actual conditions in our proclamation. That's certainly one we might discuss, but and I don't have any necessarily objection to that, but we just haven't settled on what they are. But when I'm talking about, I thought you were asking about my recommendations. They're not recommendations for me. They will be, they will be requirements in our proclamation. He may always have extra recommendations, and always has throughout this process. He and I both tell you to wash your hands. I'm probably never going to put that in a proclamation. And so there's always going to be extra add-ons to that. But the basic conditions of operating a salon or a business or a restaurant, that need to be in place for baseline sanitation and social distancing are not going to be guidelines in Oklahoma City. We are going to put them in the proclamation with an expectation that businesses will follow them, because that is the only thing keeping us safe at that point would be those conditions.
Okay, Fox 25.
Hi, Mayor. Dan Snyder here. In your speech, you clearly have reservations about allowing the reopening on May 1st. We also heard similar statements from Mayor Bynum earlier this week when the governor announced his plan. He said he had spoken with both you and Mayor Bynum before laying out his guidelines. Do you feel your concerns were heard by the governor?
I believe he listened, and I believe we did communicate, and I appreciate that line of communication. Let me qualify. Do I like May 1st? No, I said that. Do I know there's a date out there? Yes. And so, I think our hand is forced a little bit here for it to be May 1st. But, I don't think you're a bad person if your date is May 1st, and you're a good person if your date is May 6th. We're all trying to muddle through this as best we can. And so my view is that this isn't the date my gut would pick. But having said that, I couldn't bring anything to this podium today to tell you that it shouldn't be the day, because I wanted to honestly know the data, the best available data that we have today regarding the White House criteria. This is not altered in any way. This is the data. And we meet the White House criteria. We have these external factors that are not irrelevant. And so May 1st is becoming the day. Do I have reservations about that in my gut? Yeah, but I can't make major decisions based on my gut. And a lot of people, I think, have those reservations, and they would have liked more time. But that also gets to what I said in my speech, which is it's never going to be enough time, in a sense. Like, I'm not going to enjoy giving this speech on June 1st, July 1st, August 1st, September 1st. I'm not, because I know that we don't have a vaccine and we don't have a proven treatment. And so it's never going to feel good. And the only thing I can hang my hat on is we're going to do some major conditional requirements in our proclamation, and I think that the people of Oklahoma City as individuals are, as I said in my speech, as ready as they're ever going to be, and I really do believe they will make wise decisions, and I'm certainly hopeful that they do. And if they don't, we always reserve the right to do the right thing for public health, and I think that everybody in the community and at the state level would say the same, and that their calculations, their calculations would adjust as well if we see a spike in cases or deaths in the next few weeks.
The Journal Record.
Yes, this is Janice. Regarding those requirements that are not suggestions. What does enforcement look like on that? Are we going to have police shut people down or fines, or how's that going to be handled?
Well, it'll be within the same parameters of our previous proclamations. And in this case, I'm talking about, businesses. So it's a lot more enforceable. If you followed this whole evolution and this whole narrative with me this whole 6 weeks, you're well aware, because I tried to make it clear that once you move from business regulations to individual regulations, you've just broadened your field of enforcement from hundreds or thousands of entities to 650,000 people. And that's when it becomes impossible to enforce. And so I always said, shelter in place and other individual conditions are essentially self-enforcing, and you have to be my partner in this. And that's why, again, it's really hard if different levels of government are sending mixed messages. It's almost impossible to imagine, preserving a shelter in place past May 1 if you know that nobody's going to follow it, because there's a totally different message in other communities and at the state level. So, but now we're kind of pulling back to where we're focused more on a manageable number of actors. And we're talking about businesses, and we're talking about restaurants and hair salons. And that's a lot easier to enforce. What we have found, I will add, in this whole, everybody in the media always wants to ask, what's the fine, what's the penalty, how many days is it going to be in jail? Nobody ever does that. We have always found 100% of the time so far that when our police talk to somebody, they comply, they are reminded why we're doing this. It's their conscience calling. And I have no reason to think that any tickets are going to be written or anyone's going to get arrested. I have every reason to believe that, especially when everyone is allowed to open and all they're being asked to do are execute some important social distancing and sanitation protocols, I have every reason to believe that they will comply because they understand that that's what it takes to save lives. That's what it takes to have people have the confidence to even walk into their business and frequent their business. They don't want to get a reputation for being the place that's the COVID-19 petri dish, So I have every reason to believe that people will be receptive to those guidelines and those requirements, and that they are very enforceable because, again, we're talking about a much smaller universe now than we have been for the last few weeks.
Oklahoma City Free Press.
Thank you, Mayor. Brett Dickerson. I am just wondering, Mayor, and then Dr. Mack. I want to hear the answer to the same questions from you. Also, two questions. What are your greatest concerns right now? What are areas that you're going to be watching the most closely? Not so much from a standpoint of enforcement like you just got through talking about, but I mean in terms of persuasion. What are you going to be watching the most closely there, and how are you going to address those top areas of concern? Those are my questions.
Yeah. So for me, I think it's mood and it's data. I'm going to be watching people. I'm going to be watching our city starting May 1st. And as I said in my remarks, this is not the day to run into the street and hug your neighbor, right? Nothing really changes on May 1st from a perspective of the virus. And so are the streets going to be a little busier on May 1st? Yes, probably. But again, as I said, that doesn't inherently have to mean that we're in more danger if people are wearing masks, washing their hands, keeping their distance, putting their tables apart, all of the things that they should be doing. They can live in an open environment after May 1st without getting the virus if they are careful as individuals. And so I'm just going to be kind of watching that, looking for anecdotal evidence of it. I mean, it's not something you can measure necessarily, although you can a little bit if you pull the Google data on the way people's phones move around town and all that. But we're going to be looking to make sure and continuing to pound home the message that there's a deadly virus in this community. It has no vaccine and no proven treatment, and you've got to act accordingly. And so we're going to be monitoring that. And you're going to hear me in my role, trying to rally the cause, trying to rally everybody to continue to take this seriously. The second thing I'm going to be worried about, obviously, is the data. And we're going to be watching that like a hawk on a daily basis to see if there seems to be some reaction, a strong reaction. I'm not I'm not saying a mild reaction would be a major cause of concern, but if there's a strong reaction in the transmission of the virus, which then shows up in our testing and shows up in our hospitalizations, obviously that's something we will react to. I know he wanted to ask you that as well, Dr. McGough.
Thank you. I also want to clarify, I've already been notified that I misspoke on something earlier and said that we were testing less people than we actually are at our testing site in Oklahoma City. And we are doing 200 plus a day. That's an average. So I think someone said I said a much lower number than that. I've already gotten feedback on that. So for the media, I did want to clarify that. And then to your question, I think it's a great question. First of all, public health, we're always going to obviously be looking at safety and health, but in so doing, in this process, we'll be looking at cases are number one for us, hospitalizations, of course, and then we'll be starting, and you've heard us talk a lot about, we've been in a mitigation phase, and we're going to be entering more of a test and trace phase where we'll be isolating, quarantining, and protecting in that way. So we'll be looking for what we kind of refer to as hot spots. And if there's a lot of cases in a certain area, we're going to try to basically shield everyone from that by quarantining those folks and testing all the people they may have come in contact with and screening them, doing all those kinds of things that our epidemiologists are great at. And so our testing and our tracing are going to go up, just incredibly. So that's kind of what we'll be looking at. That's information, as I mentioned earlier, we'll provide to any elected official, to the community, everyone. That's part of our role, is to keep folks informed. So the mayor will know if we start seeing spikes in cases, and if the burden on the hospital emergency rooms or the number of people hospitalized changes, we will certainly address that. And I think I answered that question. Thank you.
Thank you.
Okay, thank you all. Have I missed anyone? If you have additional questions, please feel free.
Yeah, this is Bill Crum at the Oklahoman. I
Hey,
couldn't
Bill.
unmute
Okay.
previously, so I apologize for that. I was curious for Dr. McGough particularly, but also for the mayor, with regard to resources to increase testing. How many tests do you want to do on a daily or weekly basis, and how do you find the resources to get there?
So the resources have been from a number of sources as we've gone through this process. We have had private labs, the OSDH, what we call the state lab. We have people working kind of all over the place. We have had to send tests out of state to get them analyzed in the past to get results. We've tried a little bit of anything and everything, but if the question is particularly around the testing capability and availability, that is much better. It's been improving. I think I reported that last week, perhaps the week before. It seems like the last couple of weeks. I know that the governor's task force has been aggressively pursuing all kinds of opportunities to do that. I think we're going to see labs come on board in the future from our major universities, OU, OSU. I think we're going to see lots of new opportunities. We're very excited about this Walmart option, and then there's a number of things that are not even available yet for me to begin to throw out there, but we have all kinds of things coming online in the next few weeks, and those just need to be more solidified before we actually talk about those. But I think testing capability is looking very promising, especially for Central Oklahoma.
Bill, I would just add from my perspective, I don't know how to get more tests. That's not what anyone expects from me, but I do offer always my full commitment from political leadership, coordination, facilitation of innovation locally, and maybe even, the rallying of funding, if that's what it takes. So, Dr. McGough and the public health community of Oklahoma City needs to know that, their political leadership is here to do anything we can to create a more robust testing, tracing, and quarantining infrastructure for our community.
Can I follow up real quick with Dr. McGough? The CARES Act included money for local governments. I'm not clear about whether the City County Health Department has applied for or received
So,
CARES Act
thank you.
money?
Excellent
And
question.
perhaps whether it could be applied to testing?
So we will actually apply for that through the county. The county applies for that, is my understanding. They'll work with the city and with public health officials, and we certainly hope, as we have invested lots of time, energy, personnel, and supplies and all of that, that we would be a part of that, and I don't have any reason to believe that we will not be. I know that our Chief of Governmental Affairs has been in touch with different individuals from the city and the county that will be involved with that, as well as our COO, Phil Maytubby. They've already been working with people, and we expect to receive part of those funds. I don't think actually dollars at the moment are the reason that anyone doesn't have testing availability. It's more about there's always a component missing in the past, and there's always the ability for enough analyzation of the machines that are needed. So those kinds of things were less about money and more about exactly having the volume that we needed of all of those elements. But we definitely need money. We look forward to receiving some of those dollars, and we're hopeful that there'll be other opportunities too, perhaps later on through FEMA and other such resources.
Okay, and
Hey,
to
Bill,
follow up with the mayor real quick.
Bill,
on-
if you have
Yeah.
others, can you just email those to us? Do you mind? We want to just give the opportunity for anyone else on the call.
And
that I may have
Bill, you know my
Yeah.
phone number. Call anytime.
Yeah, that's fine. I had one more for the mayor, but I can call him.
Yeah, just call me.
Okay.
Okay, again, if you have further questions, please feel free to call or email us, and we appreciate your participation today.